Jacqueline, you're the first one on Instagram tonight. What's going on? Walt, what's happening, man, on Facebook? Instagram is slowly coming on board. AJ Mullins, 9808, self-made, 242, 791C. What's going on for joining? Thank you, Miss Chalk, _843. I think this is my first time seeing you on the show tonight. Ryder, what's going on? Ryder 98, how was your day? Hope you all had a great day. Nicole Bartlett, hey, how you doing? Hope you had a great day. Sloppy Becky, what's going on? Good to see you on tonight. Good to see everybody. Miss Bama 66, what's going on? Good to see you as well. Martez Gerard, thank you for joining. We're just waiting as we normally do for the viewers to join, and then we'll get started. Not much, Ryder 98. We just, it's hump day, so we always glad to have a hump day coming around. What's up, Becky? Good to see you on the show tonight. Let's see who's joining on tonight. Lovely D _27. Thank you for joining. Martez Gerard, what's up, Frat? Thank you for joining. I appreciate you. You know that alpha love is always there, man. My Instagram folk, y'all are blowing me up tonight. It's this Facebook folk is taking a little bit longer. We got Walt on. We got Nicole Bartlett on already. So we're just giving them a little bit more time. You know how we do on the big Wednesday night. We like to give people a little bit of time. Lovely D _27. What's going on? Thank you for joining our show on tonight. I think this is your first night. I don't remember you on the other night, but thank you so much for joining. Vignes, thank you for joining. Daniel Henley, what's going on Big Facebook? Thank you for joining. Miss Chandler 76, thank you for joining. So we're just kind of chilling out, saying hello, welcome, this, that, and the other, waiting for everyone to get settled in to their nightly routine. Gifted Hands 44, how you doing? Laterica Whipple just joined. She's watching on tonight. Thank you very much. Hello there, Gifted Hands 44. So we're just waiting, waiting for everybody to join. Cynthia Lingard Gore has joined the show on tonight. Dana Dane has joined on tonight on Facebook. Now the Facebook fans are waking up. I think they were sleeping early and forgot they were supposed to watch the show on tonight. But now they're waking up. Hey, Laterica, what's going on? Make sure Phyllis is on the show on tonight. If she's in the bed laying down, or I tell her to get on up and come on and join the show. Johnny R.M. Gaithers, thank you for joining. H7HP, thank you for joining the show on tonight. We appreciate you. Thank you guys for spending some time with me. So we're just kind of hanging out for just a second, waiting for people to come on board. And while we're doing that, I always like to ask B. Murray 90, thank you for coming on board. I always like to ask you to shout out your location, where you're from, shout out your city, or better yet, shout out your state so I'll know where my viewers are from. Of course, I'm here based in Atlanta, Georgia, the Black Hollywood, so to speak. So where are you guys from? Jordan Smith, thank you for joining. B. Murray 90, thank you for joining. Laterica, I know you from right around the corner from Mableton, Georgia. Cynthia Lingard Gore from Columbia, South Carolina. Deep in Columbia, South Carolina. What's going on? Jordan Smith. Mala Harris, 1975. What's going on? B. Murray 90. We got somebody shouting out from Baltimore, Maryland. B. Moore in the house on tonight. Darwin, what's going on, my buddy? What's going on, Darwin Hobbs? Thank you for watching the show on tonight. We got somebody, Martez Gerard from Albany, Georgia. Not too far up the road. A couple hours. Turks and the Caicos. Lovely D. That is what's up from the Turks and the Caicos. I love it. Darwin Hobbs shouting out from Cincinnati. Jacqueline Galvez from Revere, Massachusetts. What's up, Charlene? Let's see. Kanye, Georgia. Jordan D. Smith. That's just right up. That's just a rock star up the road. D Stud 1906 joined. Dana Dane. Where you viewing from, Dana Dane? Let's see. Daniel is viewing from Macon, Georgia. Nicole Bartlett, where are you from? And Walt X, where are you from? Mala Harris, 1975, from California. So I think that's and the Caicos is a long distance too, so the Caicos kind of got you. So Cali, Zay Barge, what's going on? Denise, what's happening? Thank you guys for coming on board on tonight. We're asking to shout out your city or your state where you're from, so I'll know where my viewers are from. D-Stud 1906 from Birmingham, Alabama. Right up the road. Right up the road. See, I am your voice. Joined on Instagram. Denise J. Ballage from New York City. DC Slick has joined watching the show on tonight. Great. Philip Forrester, thank you for watching on tonight. We appreciate you taking time out of your busy day to spend a few moments with the Dr. Ron on the Wednesday evening. Bear in mind, everybody, we're here every Wednesday night from 8 to 9 o'clock. And I will typically announce the topic of discussion for the show, usually on Tuesdays. If not on Tuesdays, definitely I'll post it on Wednesday morning. So you'll know what we're going to discuss, what the show is going to be about. If I'm going to have a special guest co-host or something like that, you'll always know that in advance. Also, if you ever have a topic that you think would be great for us to discuss, then feel free to, what's up, I am _Christopher, what's up? Thank you for watching on tonight. If you ever have a topic that you would like for me to discuss on the show, please feel free to inbox me, send me a direct message, however you want to send it. Send a message by carrier pigeon, by UPS, FedEx, however you want to do it, whatever. Just send it to me and we'll look at it and determine if we want to use that topic on the show or not. But we're going to go ahead and jump right in on the show on tonight. So first question I want to ask everybody is, how's your week been? It's hump day. Oh, we got some Jelena Giles. We got Oklahoma City, Oklahoma. We got Philip Foster on Facebook, ATL, but in New York City. My bad. So how's everybody been? How's your week been? I know everybody's been busy, on the grind, being entrepreneurs, getting your stuff together, making dreams happen, following your vision, and all that good stuff. So my week has been great so far. It's been quite busy, but we're making it happen. I actually just got in from the gym. Thank you, IMJ Legacy, for watching on Instagram. I just got in from the gym probably 15 minutes ago. I was running terribly late. There was an accident on the highway, so I'm like, man, I'm not going to make it for the 8 o'clock show, but I made it here just in time, so I'm here. Miss Wills 4512, thank you for watching the show on tonight. But yeah, my week has been real great. I'm excited about the upcoming Mother's Day weekend, so shout out in advance, because when I see you guys again next week, Mother's Day would have already passed. So for all those mothers out there, all those mothers who are watching the show on tonight, shout out to you. Kudos for you for all your hard work and all your dedication and all your love that you impart to us. So shout out to moms. Do I have any moms watching on tonight? LU_melodic. Thank you for watching on tonight. Any mothers watching on tonight? I think there might be a little delay, as usual, in my comments and then when you actually see the comments. Any mothers in the house on tonight? Jason Singleton on Facebook, thank you for joining. Thank you for watching tonight. Jacqueline, yeah, you're a mother. Miss Willis, happy Mother's Day to all the mothers. What other mothers we have watching on tonight? Laterica, I know you're a mom. You ain't say nothing yet. How many other mothers we have watching on tonight? Myla Harris, 1975. Nicole Bartlett is a mom. Well, just hello and just happy Mother's Day in advance. Happy pre-Mother's Day. Actually, you guys should be celebrating Mother's Day every single day of the year, not just one day out. Mothers, y'all need more than one day of the year. Thank you, Jason. Appreciate that. Y'all need more than one day of the year to celebrate all the stuff that y'all do. Gifted Hands 44 was going on. Happy Mother's Day to you as well. Thank you for spending some time with us on the show on tonight. We certainly appreciate you. Lou_melodic. Yes, yeah, mothers need to be celebrated every single day of the week. Every day of the week, mothers need to be celebrated and should be celebrated. Rightly said, should be celebrated every day of the week. John McKnight, thank you for watching the show tonight. We appreciate that. Jacqueline Galvez just commented and said today is Mother's Day in her home country of Guatemala. Excellent. So you're celebrating Mother's Day on today. Good job. Normally, my mom is on the show every Wednesday night. I have yet to see her come in or comment yet on tonight, but hopefully she's gonna come in and give her 2 cents on some of the discussion we're having on tonight. Mr. Doctorate, thank you for joining on tonight. We appreciate you. So let's get right into our topics of discussion for tonight. Again, I like to always highlight if there's a special month that we're celebrating. I like to highlight some points about that month. So this month is actually Mental Health Awareness Month. So as I did last week, I posed some questions and I want to get some responses, some answers from you guys to let me know whether you think it's a myth or whether you think it's true. So the first question is, or the first comment is, people with mental health problems are violent and unpredictable. Do you think that's a myth or is that true? I'll give you just a second to digest it or to hear the question. I'll read it again. People with mental health problems are violent and unpredictable. Is that a myth or is that true? Is it true that people with mental health problems are violent and unpredictable? Can you say that that's 100% true? I see a lot of comments. Some people saying that they can be true. Some people said it's a myth. So I'm waiting on a few more responses. So I'm going to ask the question one more again. The question is, whether it's the statement is people with mental health problems are violent and unpredictable. What y'all think about that? Drum roll. I had to think about that when I first read it earlier today. People with mental health problems are violent and unpredictable. So the answer is most people with mental illnesses are not violent, and only 3 to 5% of violent acts are attributed to people with mental illness. So the question is, that's really a myth. I mean, you can have some people who are mentally ill. You're right, Nicole. It depends on the situation, really. Depends on the issue. You can have some people who are mentally ill who are violent, but the overall, premise is that people who are mentally ill are not any more violent than someone who is not mentally ill. All right? And then the statistic says that only 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. So overall, that is false. It's a myth. That's fake news. All right? So the next one, we'll talk about if this is a myth or is it true. People with mental illness or mental health needs can't tolerate the stress of holding down a job. Let me read that again. People with mental health needs, even those who are managing their mental health needs or issues, cannot tolerate the stress of holding down a job. So basically they're saying people with mental illness cannot hold down a job because jobs can be stressful. I'm going to pause just for a second to wait for the comments to come in. I see a couple falses that have come in. Phaedra Gathers, thank you for joining, watching the show on tonight. So Clarissa Wright says that's a myth. Sloppy Bacon, I like that. Sloppy Bacon says that might be an excuse that they use, that because they're mentally ill, they can't handle the stress of being on the job. That's a good excuse. King Cali 85, thank you. Lou_melodic says that's a myth. So let me read it once again for those who missed it. The statement is people with mental health issues, even if they're managing their mental health issues, cannot tolerate the stress of holding down a job. Is that a myth or is that true? So let me look at some of the comments. So Clarissa Wright says, I know a woman who battled bipolar disorder and she runs a daycare very successfully. She is managing well and have been for the past 10 years. So in light of that situation, Clarissa believes that is a false statement, I would assume. Christopher Green, thank you for joining from from Orangeburg, South Carolina. Philip Forrester, great, not necessarily. So the answer is that is a myth. So people with mental illness don't necessarily have issues with tolerating stress on the job. Somebody said that could be someone's giving an excuse because you have a mental illness that you need to call in for work. Say, oh, this is too stressful, I can't handle it. So that might be a good little excuse. So if that's your excuse, I'll just bust your bubble on the night. So you can't use that no more. That ain't gonna work next time. Deborah Purcell Nelson, thank you for watching the show. And I'd like to see you on the show every Wednesday night from 8 to 9 o'clock. You gotta join us. All right, so the third one. And what we're doing, ladies and gentlemen, we're talking about, since this month is Mental Health Awareness Month, we're talking about different mental health issues. So every Wednesday, I'm going to introduce some myths, and we're going to talk about whether they're myths or whether they're true about mental illness. So this is the third one. Check this one out. Therapy and self-help are a waste of time. Why bother when you can just take a darn pill? So let me say that again. Therapy and self-help are nothing but a waste of time. Why bother when you can just take a pill? Is that a myth or is that true? So basically they're saying that going to therapy, which could include counseling, it could actually include going to see a pastor or what have you. They're saying therapy is not going to help. They're saying that you might as well just take a pill. That all mental health issues can be eradicated or treated by just taking a pill. How does that fare with you guys? You think that's true, that's a myth, or you think that's false? Floppy Baker, what you laughing at? So is it true or false that why bother just using a pill? I mean, why bother with going to a therapy session when you can just take a pill? So they're basically saying that if you got some type of mental illness, you just need to take a pill. Don't worry about going to your therapy session. Ms. Wills 45112 says they're making more money off of you by taking medication. You're definitely right about that. Rider 98 says pills can't solve it all. You're right. Pills can't solve it all. But Sloppy Becky says some people do need a pill. So I'm not saying that a pill is not going to help you. If you're on a pill, by all means, please continue to take your pills. I mean, if you're on a pill for some mental issue, depression, suicidal thoughts, anxiety, whatever it might be, take your medicine. But for this question, that's really a myth. So counseling is a part of it. It's a big treatment plan that goes along with treating persons with mental health. So medication sometimes is necessary. Also, counseling works. It works well. So counseling in combination with medication works extremely well. Rodney Perry Live, what's going on, buddy? Thank you for joining my live show. We're here every Wednesday night, Rodney Perry, from 8 to 9, man. This is my first time seeing you, but I thank you for joining us on tonight. Big kudos. Shout out to you, my man. Ella PB on Facebook, thank you for joining. Philip Forrester, you was right. That was a hell of a myth. But listen, let me say this again. If you taking a pill for depression or anxiety, keep taking your medication and go to your counselor. Thanks, Rodney Perry. I'm well, man. Good to see you. Hope you're well too. Always good to see you, man. So we're finished with that segment about mental health. Remember, there's Mental Health Awareness Month, so we shouldn't be talking about people with mental health are crazy. All of them crazy, because they're not. But Miss Forever Missy, we're gonna get to the topic in just a second. Give me just a second. Got a few things to take care of before we get to the topic. We were talking about, actually, at that time, we were talking about mental health because this month is Mental Health Awareness Month. So I was just highlighting some things, some myths that are out there in regards to individuals who are mentally ill. And so we just kind of wanted to debunk some of those myths, being that this month is Mental Health Awareness Month. And we'll talk about some mental health issues every Wednesday night for this month, since this month is mental health issue. Now, next month, we'll be talking about whatever else next month is, which may be National Wear Your Baseball Cap Month. Just joking. But we'll talk about that. So, one of the most important topics, or the most exciting topics I have on the show, is a topic that's called What's Hot and What's Not. So, I choose something that I think is hot, and then I choose something that I think is not, and we kind of talk about it. And you tell me if I'm right, if I'm wrong, if whatever I say is hot. If it's really hot, you tell me if it is. If it's not, you tell me if it's not. And then we make comments and we talk about it. Then after that segment, we'll get to the topic of discussion for tonight. So what I think is hot, does everybody know, is it Gabby or Gabby Sidibe? Do y'all know Gabby Sidibe? Gabby Sidibe is an actress. She is acting on the show Empire, which is coming on right after my show at 9 o'clock. But are you guys familiar with Gabby Sidibe? Gabby Sidibe. I'm waiting for y'all to respond. KK62074, what's going on? Theo_Rothschild, thanks for joining on the big gram on tonight. So Gabby Sidibe. We know who Gabby Sidibe is. I'm getting some responses now. This is my What's Hot, What's Not segment. So Gabby has had bariatric surgery, meaning she has had surgery to lose some of the weight that she has. I mean, Gabby was a big girl, but it's interesting that Gabby says she wrote a book. The book is called "This Is Just My Face, Try Not to Stare." Again, the name of the book is "This Is Just My Face, Try Not to Stare," which came out actually, I believe it was this year. And she talks about some interesting things in her book. She talks about how she dealt with depression, how she dealt with anxiety, and also how she dealt with bulimia, which we're going to touch on that a little bit later on in the show. She was bullied in school. All of that happened before she even decided to undergo laparoscopic bariatric surgery. So she looks great. I mean, of course, she looked great before. And sometimes, we as people can be so darn mean to others, because people don't look the way that we want them to look, or people don't look like us. Then we tend to point the finger. Like she said, she was bullied. And if you're bullied, I mean, that can lead to depression and anxiety. She was bulimic. So she had a lot going on. So no one really knows your individual situation unless you're right there living that situation. But she said this, and I quote, she says, "It has taken me years to realize that what I was born with is all beautiful." She writes in her book. Listen, I'm going to say it again. She said, it has taken me years to realize that what I was born with is all beautiful. Meaning it's all good. Whatever you're born with, whatever it is. She said, "I did not get this surgery to be beautiful. I did not get this surgery to be beautiful. To be beautiful." She said, "I did it so I can walk around comfortably in high heels. I want to do a cartwheel. I want not to be in pain every time I walk up a flight of stairs." So Gabby's motivation for getting the surgery was really, really different. She said she didn't do it to be gorgeous. She did it to not have pain when she wore high heels, or she wanted to do something that we all take for granted if we can, when we can do a cartwheel, go outside and do a cartwheel on the lawn. And she said she just didn't want to be in pain when she walked up a flight of stairs, which is quite interesting. I'm getting a lot of messages on Instagram, on text messages from individuals watching on tonight. So that's what's hot. So did y'all think that was hot? That Gabby has taken it upon herself to make a lifestyle change, to get rid of the weight and take steps to keep the weight off. That was hot. That was hot. And for her to come out and say, to be really transparent and say how she was bulimic, how she was depressed and anxiety and all this good stuff, I think it's wonderful, just wonderful. So that's what I think is hot for this week. Now, I want you guys to comment on this shiggity. What I think is not this week. Let me ask this question. I really don't get into politics a whole lot. But lately I've been forced to take a front seat to politics. So what's not hot this week is the Trump-Russia investigation. How many of y'all been following the Trump-Russia investigation? That's right, Rider 98. I don't want to watch it, but I've been forced to watch it. When I tell you that thing has that Trump-Russia investigation has so many turns in it, you would think you're on a roller coaster. I mean, it has so many ups and downs, so many twists and turns, so many steep barrels, so much going on. And to tell you, it just makes sense if you think about everything that's been happening. Yesterday, Trump fired his director of the FBI. Why would he fire the director of the FBI? The guy who was actually overseeing the Russia probe. He fires him on yesterday. The guy who was seeing the investigation to any shenanigans that was going on between Trump and the Russians, or the Trump campaign and the Russians. He fires him on yesterday. Months ago, he fired the Attorney General. Sally Yates, I believe is her name. And she has some good information this week that she shared when she testified, I think was before the Senate subcommittee or something. It's quite interesting, and I'm going to leave it at this, but for me, it's quite interesting that you are, you're right, it's quite interesting to me, and y'all tell me if I'm wrong, that you are actually getting rid of everybody who has information about your shenanigans with the Russians. Interesting thought. It makes us think about Watergate, which happened back when I was a young kid, or maybe before I was even born. So it makes you want to say, So we're not going to continue to dwell on that tonight, but that's what I think is not hot, is the Trump-Russia investigation. So Sloppy Becky said if Donald Trump was a Democrat, he would have been impeached by now. Donald Trump would have been impeached 2 months ago if he was a Democrat right now. KK says he uses his platform to devalue people in authority that worked hard for their jobs. And I certainly agree with that. He said that's why he's getting rid of them, but I hope they join forces on him. Yeah, he's getting rid of everybody that has any information about him. But I think that is probably going to backfire. Maxine Waters, when I tell you she's a firecracker, I call her a pit bull. I'm scared of her myself. I think she's a Democrat. She's a representative from, I think, California. But she tells it like a T.I. is. So she says he's going to be impeached. So that's another topic for another day. Maybe that's going to happen. We'll have to wait and see. But it's a never-ending saga. Every week there's something different, or every night there's something different. Every morning you wake up, there's something different in regards to this Russia-Trump stuff. So I tell you, it stinks, and it's not a good smell. So it stinks and it got a good smell, but we'll talk about that later on. So tonight, the topic of discussion tonight is eating disorders. Has anyone ever heard of eating disorders? Oh yeah, Aunt Maxine. I love Aunt Maxine. I'm scared of Aunt Maxine though, Sloppy Becky, to be honest with you. So the topic of tonight is eating disorders, and that is more than just about the food. Have you ever had a friend or a family member who had an eating disorder? I'm going to wait and see what you guys say. Have you ever had anybody that have had an eating disorder? That's right, KK, I agree. JY Ham, thank you for watching on tonight. Elisa, Dr. Wade, thank you for watching on tonight. So eating disorders are really fairly common, and I think that's something that is not really talked about a lot. So, but it's something that's really, really important, and something that needs to have some light shed on it. So in your minds, what are some of the eating disorders out there? What are some things that you've seen? Some eating disorder that you've seen. A lot of people on the show are commenting that yes, they have people in their family, their daughter, their niece, who in fact have had eating disorders. So what type of eating disorder did they have, if you don't mind sharing with us on tonight? Miss Galvez, 1981, Orida, 98, Sloppy Becky, Miss Willis. Overeating, so that's one that we're really going to talk about. Overeating is a big one. Somebody else is saying overeating as well. Anybody else? We're talking about eating disorders on tonight. So what do you think, while we're waiting on other people to comment, why do you think that eating disorders exist? It's not like the title of the session tonight is eating disorders, not all about the food. So why is it that why do people actually overeat? There's got to be some additional underlying cause or something that the person is experiencing that will cause them to overeat. And that's an interesting segue into this topic because this month is National Mental Health Awareness Month. So it's interesting that frequently with eating disorders, they exist with other things. So it's usually not the eating disorder that exists by itself. It's usually a combination of the eating disorder fueled by either substance abuse, anxiety disorders, and or depression. And Miss Willis 45112, you're right. A stressful life can be a reason that we develop an eating disorder. So it's not about I want a bunch of cake, I want a bunch of fried chicken, I want a plate full of collard greens. It's about a lot of other things. We're unhappy with our life. We could be unhappy with the way we look. We could have been bullied, just like Gabby Sidibe said. She said she was bullied, so she was depressed too as well, and she became bulimic. So I think in her situation, all of that played into her becoming bulimic because she was depressed and she was bullied. So all those things will force you into those type of situations. So let me ask this question. Let me just throw it out there. Do you think that eating disorders affect men or women more? I mean, it affects both genders, male and female, but there's a overwhelming predilection for one gender as opposed to the other. So what do you think? Do you think eating disorders are more prevalent in men, or is it more prevalent in women? And then we're going to ask the question, why? Okay, I see Rhonda 98 says both. Okay, Kay says both. Jacqueline says both. Deborah Purcell Nelson says women. Rhonda 98 says women. So let me ask the question again for those who may be just joining. Eating disorders, is it more common in men or is it more common in women? Now, mind you, it can occur in both genders, but it has an overwhelming predilection for one gender as opposed to the other. So which gender do you think is more common in, men or women? Official _ Brandon Sims, thank you for joining the show on tonight. We appreciate you for hanging out with us for a little while on tonight. So the answer to the question is, it's 2 times more greater among women and girls than men or boys. So you find an overwhelming majority of women and girls developing eating disorders as opposed to men. So that's an interesting point interesting place where we can stop and discuss that. So why is it that we find more eating disorders in women than in men? Why do you think so? Is there a reason why we see it more so in men other than women? And the research is still really out. There's a statement that says that eating disorders are extremely complex. So you can't say that's really caused by one particular thing. It's a combination of biological, psychological, and environmental factors. So let's talk about that. So you're right. Women and men tend to drink and smoke or exercise to relieve stress. Okay, gotcha. Tinkerbell091776, thank you for joining. She says, because society makes women believe they're supposed to be thin. That's an excellent question. Ms. Willis 4512 says, we're more emotional, maybe. Ryder 98 says, because some women feel their life is stressful. I kind of agree too, but there are some men that feel like their life is stressful too. I mean, my life is hella stressful, but I don't want to go binge eat. I mean, I like to eat, but I'm not going to go binge eat. Appreciate your official Brandon _Brandon Sims. Fade Together says, coping mechanism to deal with daily problems. That's a great answer. Ryder says, men don't let things affect them like women do. I mean, I can agree with that. I think men just, at times, we deal with situations a little bit differently than women do. But I think we all get affected by things. Men don't care as much about the way they look. So the overwhelming consensus is that I guess you guys are saying that society is a vain, or we're vain, and we're more concerned about what people think about us, or concerned about how people see us. That's an interesting segue into what Phaedra just posted. Society plays a major role in body image. Self-esteem and self-worth is not taught at an early age. That is true. Very, very true. Thank you, K_K62074. I appreciate that. Thank you. Appreciate that. So, interesting. It's interesting. Denise Mackins, thank you for joining on the show on Facebook on tonight. It's interesting because they say that there are some irregular hormone functions that can cause eating disorders. Genetics can cause it, nutritional deficiencies, but the biggest category of things that will cause an eating disorder is what we call psychological factors. And that means negative body image and poor self-esteem. Now, how often have you, when you were in grade school, you were in middle school, or you were in elementary school, how often were you taught about positive self-image or building up your self-esteem? Was anybody taught that in school? Was anybody taught that in school about thinking so highly of yourself, no matter what imperfections that you may have? Anybody think? I mean, anybody was taught that in school? I know I wasn't. I mean, yeah, they might have touched on it, but a little bit, but I wasn't really taught about that, about having a positive self-image about self, and even so, having to deal with people telling you that you are this or you are that, telling you what you believe that you're not. And so a lot of times when we're at a young age, we're so impressionable that we begin to believe what people say. K_K62074 says she learned it in the 4th grade. That's great. Because as young kids, we are very impressionable. So what we learn at that age will dictate a lot of our paths for the future. Let's see. I think the generation make a difference. They do more so now, but not in my generation. You're right. I think now in the school system they're adding a bunch of that into the curriculum, which is really great. So hopefully that will help lessen the occurrence or prevalence of eating disorders. They also says there's some environmental factors like a damn dysfunctional family dynamic. Who would have thought that a dysfunctional family dynamic would cause someone to have an eating disorder? Why so? How many of us have had a dysfunctional family dynamic? How many people do not? I'm transparent. I've had a dysfunctional family dynamic. They say that that's one of the reasons, one of the environmental factors that cause people to have eating disorders. Laterica says she didn't learn that, not really in school. We had a program called Girls Incorporated that was put in place to build self-esteem and girls' empowerment. It's kind of like what we had in school too, We had these after-school programs that would, introduce us to all facets of life and teach us to think highly of ourselves or what have you. But there was nothing really taught in the school in regards to that. So we talked about a dysfunction. They're saying a dysfunctional family dynamic. And another thing, have you ever seen a ballet commercial on TV and an overweight girl was doing ballet? Come on. Have you ever seen that on television? A commercial about ballet. And have you ever seen an overweight girl doing ballet? Have you ever seen an overweight girl doing ballet? No, I don't think so. Well, Ryder says she has, but I haven't. So impression is everything. So we see these things on TV. The young girls see these images on television, and they want to actually be like these people. So, and they think the only way they can be this way is to lose weight, to not eat. So it's just a lot of different things that play into it. Sports. We love to watch sports. No, Becky, I'm not throwing shade. We like to watch sports, but sports is so, concentrated on maintaining a great lean body for enhanced performance. So a lot of times you see, like I said, ballet. You never see a heavy lady or a heavy girl really doing ballet. And gymnastics. How many times have you seen a really thick girl on the U.S. gymnastics team? I did say a thick girl. My bad. How often have you seen a heavy set person on the United States gymnastics team or on the diving team? Very rare. Have you seen something like that? So a lot of that is environmental factors. We see it on TV. Our young people are being bombarded with this every single day. Rico, thanks for joining on Facebook. Appreciate you. We see that every day, every time we turn on the television. We see it every day. Never ever do we see a heavyset girl about to compete in the Olympics on the synchronized diving team. If you've ever shown somebody, please say you've seen them. And if you know who it is, please inbox me their name so I can look it up on YouTube or I can look it up somewhere, because I've never in my life seen that. Now, someone just posted on Facebook that Simone is the closest we've gotten to a thick girl. And Simone Biles is not really thick. She may be a little bigger than some of the other girls, but she's not really a thick girl. So environmental factors. So, and also family and childhood traumas. Like if you had severe trauma as a child, if you've been sexually abused as a child, some of those things they say, research says can lead someone to developing an eating disorder. Yeah, Tinkerbell 091776. Yeah, Simone is more muscular. I don't think she's fat. I think she probably has little body fat at all. So peer pressure. They're saying that peer pressure. When I looked at that, I'm like, peer pressure. How can peer pressure cause you to binge eat or to starve yourself? But anyway, let's go through a few. It's really just three, so it'll be pretty short, and you guys can make comments about it. There's really three different major eating disorders that are out there that we kind of equate with the more relevant eating disorders. And the first is binge eating. And basically it's what it says. It's what the word says. It's binge eating. You just lose control over what you eat. Okay? You just eat. And after you eat, you don't necessarily want to go work out or you don't want to fast or anything like that. You just eat just to eat. And as a result of binge eating, what happens? The result is just overweight. You just become overweight. You just become a big kid, a thick kid, after overeating. So, but the thing is, what happens is like a catch-22. Chef Tregage, thank you. That's my buddy from the Food Network, y'all. Y'all say hello to Chef Tregage Frazier from the Food Network, doing big things. Thank you for watching the show tonight. I really appreciate your support. Kudos to everything that you're doing. Bless you. But the crazy thing is, with people who binge eat, they get pissed off and guilty about their binge eating. Or they feel periods of distress about their binge eating. And that leads them to binge eat some more. So it's a ever evolving cycle. They binge eat for whatever reason. Could be emotional, could be stressful, whatever. And then they binge eat, and after they binge eat, they get depressed because they just binge eat. They just binged. And so they experience guilt and shame, which causes them to go binge eat again. And the ultimate outcome of that is excessive weight gain. So that's one. So that's binge eating. The second one, which most of us have pretty much heard of before, is bulimia nervosa. Bulimia nervosa. So they binge eat, and then what do they do afterwards? They try to get rid of it, either by making themselves vomit, or using laxatives or diuretics, extreme fasting, excessive exercise, or it could be a combination of these things. Now, mind you, all of these eating disorders, like we've talked about tonight, and this is just the second one, are caused by a lot of different things. So we never know what's going on in a person's life. So that's why I choose not to judge anybody, because you never know what anybody's going through. They're not just eating just to be eating. I mean, so it could be, it's got to be some underlying thing that's going on to make them want to do that. So with bulimia, unlike binge eating, bulimics, all they eat, and then they try to get rid of it, which is interesting. And so these are some things that if you suspect that someone is bulimic, these are some things that you should look for. If they chronically say they have a sore throat because they're making themselves vomit, so they're going to chronically have a sore throat. They can get severe dehydration, acid reflux. Their teeth can start to decay, all because they're making themselves vomit. So they're bringing up a lot of acid from the stomach, and the exposure to the enamel on the teeth is not healthy. I wish my friend Heavenly was on the show tonight. She could talk about that as far as the effects of the acids on the enamel on the teeth. But so those are some things that can happen when you are bulimic and you make yourself actually vomit. The third one, so we talked about binge eating initially, then we talked about bulimia nervosa. So binge eating is just eating, not worried about getting rid of the food afterwards. You just eat. Then you feel depressed by what you ate, or you feel down or discouraged. Then you eat again, which leads to extreme weight gain, ultimately obesity. The second one we talked about was bulimia nervosa, which of course bulimia is when you eat, you binge eat, but as opposed to you eating more, you try to get rid of what you just ate by either using diuretics, not diuretic, but laxatives, working out, or making yourself vomit, self-vomiting. The third one, and the last one, is anorexia nervosa. Big fancy term. So an anorexic is different from someone who's bulimic or someone who overeats. An anorexic, in their mind, always sees themselves as being overweight. 99.9% of the time, an anorexic is not overweight, but they see themselves as being overweight. Baby girl Drea, thank you for joining. Coolski, thank you for joining. Appreciate you. So they weigh themselves repeatedly because they think they've gained 5 pounds overnight, or they've gained 10 pounds overnight. So they may binge eat too, but then they participate in extreme periods of exercise, extreme dieting, self-induced vomiting as well, diuretics or enemas, because they actually see themselves or perceive themselves as being overweight. So I've given a lot of information on tonight on the 3 most common types of eating disorders, binge eating, bulimia, and anorexia. So these things, they've got to be some way to treat this. But we've got to learn how to recognize some of the symptoms. So there's medical care that can be given, because most of the time there is some underlying psychological or some psychosocial, some kind of something going on that has caused this particular activity, or caused the person to participate in this particular activity. So we've got to find the root cause of what's really going on in order to really treat the patient. Medications, if the person is depressed, an antidepressant may be great to use. Counseling also is excellent. It's not just one thing that will work. You've got to have, it's a holistic approach. It's a lot of different entities working together in concert to take care of this issue, because it's a major issue which can lead to death. So we don't want that to happen. Also, individual, group, or family counseling can help as well. There are some individuals who, especially individuals who are anorexic, who actually have to be hospitalized, because if you're eating and then you're making yourself vomit, or you're taking a laxative to get rid of that, what you just ate, then you're going to become malnourished. And since sometimes malnourishment is a cause, and these individuals have to be hospitalized on many occasions because of the complete, they're losing food, they're underweight. So most of the time, they have to be hospitalized. But the good thing about it, which is the rainbow on the other side, is that it can be treated. So complete recovery is possible in these particular conditions. So I think it's important, and the reason I want to talk about this tonight, I think, Jacqueline, shout outs, kudos to you for sending the kid a message and saying that this was a great topic. So shout out to you for sending that message, and actually that trumped my topic. That trumped the topic I wanted to talk about on tonight on the show. And so I placed eating disorders on the show, but I certainly appreciate you so much for giving me that bit of information. So in conclusion, we're here every Wednesday night from 8 to 9 p.m. right before your primetime shows come on. I know you're probably waiting for Empire. Thank you, the Crystal Chanel Show. Thank you for watching. We certainly appreciate you. But we're here every Wednesday night from 8 to 9. I'd like for you to just welcome your friends. Tell your friends to come out and join us. Share the information. Share the post. I'll post the topic of the show. And if I'm going to have a guest co-host, usually on Tuesdays, and then I'll post it again on Wednesdays to let you know exactly what we're going to be discussing on the show. We've had great numbers. The numbers have been increasing every single week since we started the show about a month ago, 2 months ago. So the numbers have been exponentially increasing. So we certainly appreciate that and appreciate your support. Also, make sure if you're following me on Instagram or you're not following me on Facebook, go check me out on Facebook. It's Rondrick Williamson on Facebook. If you're not following me on Instagram, it's at the Dr. Ron, THEDRRON on Instagram. Also the same on Snapchat. Now on Snapchat, I'm just raw and unfiltered, just like I am on the live show, just raw and unfiltered. You get to see the behind the scenes shenanigans of Dr. Ron. So jump over and follow me on Snapchat. It's at the Dr. Ron, THEDRON. So check me out. I look forward to seeing everybody on next week. Coolski, it's okay. I know you tuned in late, but busy day in the ER. I understand. We got you. I know you watch. Hey, Janet, what's going on? What's going on? Thank you for joining on tonight. So it's like 8:54. It's 8:54. So I want everybody to take the information that we learned on tonight and share it with someone. If you know someone who has an eating disorder, if you don't know how to deal with it, if you have a question for me on how to deal with it, or any additional questions that you may have, feel free to inbox me. Feel free to send me a direct message. If you yourself, in fact, are dealing with the eating disorder, I charge you to get help, because it's not going to get any better with you dealing with the situation alone. A lot of times we try to carry our problems and our issues, and we make ourselves an emotional prisoner. So we're locked up, and we're an emotional prisoner to ourselves. But we've got, in order for us to conquer that devil, we've got to have the courage to share and get some self-help. And so I thank you again for joining me on tonight. I hope to see everybody back here next week, the same time. Please invite a friend next week. So I'm going to ask next week, I'm saying, who invited a friend this week? And I want to know who invited a friend. I know Jacqueline's going to invite a friend. I know Ryder's going to invite a friend. Cool Ski probably will invite a friend too. But we want to see everybody back on next week. I want you guys to have a great week. Hope you had a great week thus far. Have a great night. Thanks, everyone.